There's a video for what I take to work, what I use in my shift. It came up. One of the nurses I work with, she works day shift, and she's usually the charge. She's usually one of the better nurses. Yeah, she's one of the better nurses on day shift. Filipino, and she's very diligent. She's very OCD, more so maybe than me. And I found out, yes, she is. She was precepting somebody on day shift, and she was like, "Oh yeah," and she was pulling out her pen and making notes, and the preceptee made the comments like, "Wow, you're really organized," and she's like, "Oh, you have no idea." So she starts pulling out all her stuff. She's like, "I use this pen for making notes and whatever," and I'm like, I'm just waiting to give them report. I'm like, "Yeah, hurry up. I want to get out of here." And I'm like, "Oh, yeah, we use the same pen. All right." She's then I have this one to check for pupils and stylus and was backup. And then I was like, "Yeah, I've got the same one." And she's like, "Oh," and then I have my whiteboard marker to do the whiteboard, and I'm like, "Oh yeah, me too." I'm like, "Uh-oh." And she's like, "I keep a scissor," and this is something most nurses do not carry. I actually had one of the fancy ones. I keep losing it. I've gone through probably 5 scissors. I go through one a year basically, and I've noticed nobody takes this scissor because it's a piece of crap scissor. It's one of the Spanish scissors. But I bought like a 6-pack from, like, I don't know, Amazon or whoever, and I still have 4 of them. But I was like, everybody takes my fancy scissors, but don't take this. But she had a scissor too, and I was like, oh yeah. Now I'm beginning to. She's looking at me, and I'm like, yeah, I have the same. And then I think she had a permanent marker, which was the difference. And she carried whiteout, actual whiteout. Not I have like a pen light whiteout here on my on this desk, but I don't carry, but I have it in my bag. Whiteout tape, and she carries it with her. She had a little tiny one, and another nurse was standing next to me. She was like, "Why do you do that?" She was a new nurse. She just finished her orientation. She's like, "What?" And the nurse that was showing off all her gear was like, "Because I want my S bars to be neat." And I was like, I'm sure I was blushing because I was like, "Yeah, me too." I want my S bars to be neat too. I don't like looking at scribbles if I had to scratch. If someone gives a mistake or something like that, what her answers were. You want your S bar to be neat. At least I do. And the new nurse that asked the question says, "Oh, I just copy over the S bars to make a new one." And both of you were like, "That's too much work. I'm sorry. White that baby out and then just write over it." What, are you kidding me? Because it's our S bars. It's not charting. It's our own, and we could keep our notes however you want. If you want to write in shorthand, that's so be it. I had most nurses take one sheet of paper, fold it in whatever origami style, and have their 1 to whatever patients, 1 to 8, 1 to 6, 1 to 4, whatever. ICU level, ER, if ER freaking writes it on their hands. Whoever, that's how they do it, but I did have a couple on the nurse that was showing off all her gear, and I was like, because the preceptee looked at me, she's like, "You do the same?" I was like, "Yes, but I don't have my whiteout tape with me, and I don't carry my permanent marker with me, but I do carry a notebook to make little jots of notes." I mean, this one still has some notes on it. MRI, the codes. This is for the Rapid Treatment Center. Their codes. Don't look. And I carry a pulse ox just in case I want to have a quick read, and I don't have the machine nearby, the hospital machine. It's a quick, dirty read. It's not something you hang your hat on, but it's something I always carry just to have it. I want to see what's going on, because sometimes I want right at bedside. I don't want to waste a few minutes or 30 seconds even to grab the machine outside in the hallway. And then I also carry a flush. I keep it packaged. It's something I learned from my preceptor. She always carried a couple flushes with her, just in case. Just, you know, during a code, when you're given epi, whatever, you need to flush at least 2 to get into the heart area anyway. So these are little tricks of the trade I always carry. And I just, if I don't use it, I take it to the next shift. So, you know, that's a little bit of what I do. I carry a separate pen. I like this pen. This is a Sharpie. Sharpie pen, gel pen. Writes really well. I've had many a resident like, oh, this writes really well. And I'm like, yes, it does. And they're like, just sign the orders and leave. All right, take your butt out of here. Just sign me my orders. And then, of course, I actually do use all the colors of this rainbow on this pen. The nurse that was showing off her gear actually had the fluorescent, the real pink pastel, the pastel version of this. And she did it for different notes. For me, black is always baseline. It's the baseline notes I do each shift. So vitals from a previous shift are in black. Whatever, any vitals or changes, new orders, I do in blue. Tasks that I finished, I'll hit green. Anything that's really hitting the fan, of course, goes red. All right. You could do whatever you want to do. And this is just a little OCD. It just triggered because that nurse did her little dog and pony show, and I was like, oh my God, that's me. You're me. I'm you. Oh my God. And we had one-ups on each other on that. And she's a very good nurse. And that helps her stay organized. Then there is, you know, the new nurse that I was just mentioning that was saying she copied all her notes over. Her mother is also a coworker of ours. She's a great nurse. And I don't think she uses paper at all. I think she just commits everything to memory. I've never seen her with any kind of real S-bar, but she has all the answers. She has all the things. Just maybe she has the napkin and she scribbles it on there. And she goes to goes through her shift. She's done before anyone else. She's usually charged on our other unit, and she leads the way. And I'm no problem. She's one of the best nurses I know. So you have 2 ends of the spectrum there. You know, that nurse who has gear up to kazoo, and the other nurse who's like, you know, just probably watching K-pop, you know, and just like, yeah, I finished the RT, it's all done. They're good. You know, I got them back. You know, we got Ross. Let me take care of my K-pop right now. I'm on break. You know, it's 2 ends of the spectrum. But, you know, it's up to you. Whatever works for you is how it should be done. There's no right or wrong way. If doing colored pens is your way of doing things, so be it. My girlfriend's a blunt crayon pencil, a blunt crayon nurse. She like, you know, really just uses like the dirty crayon to make her notes. And she's one of the best nurses I know as well. That's the way she does it. Just don't be a blunt crayon nurse and be bad at it. That is inexcusable. You know, if you got everything under the rainbow and you're not as good as you want to be, there's nothing you can do about it. You just got to give it time and hone your craft. But I dislike the ones that just kind of like said, I don't need that. I'm whatever. And they're real borderline. I'm like, put some effort to it. There's a reason why you're not losing weight. The reason why you're whatever, because you're not working out, right? That's the same concept. You got to put a little effort into it. You know, that's what it's about. I equate that. A lot of times I use sports analogies or exercise analogies, and people are like, oh, it's too hard. It's too hard. Yes, it is hard. If it was easy, everybody be in shape. Everybody would be a doctor or a nurse or a lawyer or what have you. It's difficult for a reason. And it's rewarding to overcome that hurdle. Okay? Good luck.